Hello, my name is Brian Casey. I'm editor-in-chief of AntMini.com, and we're here at the 2014 edition of the European Congress of Radiology in Vienna. We have with us right now Dr. Georg Bongartz. He is Vice Chair of Radiology at University Hospital in Basel, Switzerland, and he's going to be talking with us about turf battles in European radiology. Dr. Bongartz, thank you for being with us today.
Pleasure. Thank you.
Now, you are giving a talk today specifically on turf battles in radiology. Can you describe a little bit about what you'll be discussing?
Well, first I have to admit, when I was asked during this presentation, I was also a little bit surprised because looking up turf battles, I didn't know what exactly that was in right terms. You have a comprehension of that, and that was obviously wrong. So everybody knows it's about competing and not working together, but fighting each other. Meanwhile, I got a lot of insight into this, and in a way I'm also quite happy that we are, at least in Basel, were lucky enough to have some options to overcome these turf battles. So there is definitely a challenge. It's usually called a problem or an issue, but I think I better like it to be a challenge, and we can learn a lot.
Are more radiologists buying, or are more non-radiologists buying medical imaging scanners? Is that where we're seeing some of these conflicts occur?
Definitely, and they may have reasons for that because they probably get better at service doing some things themselves. They can have better medical knowledge, not the technical knowledge, and we must now avoid to be restricted to the technical part only. Therefore, I think we must have a different look at the entire problem.
Is some of this being driven by management trying to reduce costs in medical imaging?
To reduce costs and also to get money out of imaging, and this is by hospitals or hospital managers. Therefore, there is a trend that imaging goes more into the clinical areas, and this then may escape of radiology.
Okay. Have you been personally involved in any sort of turf battles?
Lucky we managed to cooperate on a very early stage with our, let's say, clinical competitors. And this is, I think, one of the better ways to go out of this turf battle.
Can you describe that a little bit more? Is that possibly a solution to these sort of conflicts?
I definitely think so. Cooperation and also to become more knowledgeable about all these relatively tiny and very complicated medical things which radiologists usually are not completely aware of. That's the way out of these turf battles. We must get better, more detailed and more concrete to what we are imaging and what we are reporting on, and then there will be an added value of radiology which will be seen by our medical colleagues.
Okay. In general, are you optimistic about the prospects for radiology when they come into conflict with other specialties?
I am. I definitely am, and that's the good news. Turf battles do exist, but you have to deal with them in a clever way, and then it's not a problem. It can even turn into a win-win situation.
Okay, very good. Dr. Bongartz, thank you for being with us today.
Thank you.
All right, signing off for AntMini.com, my name is Brian Casey.